Well, today on The Real Story, we are in unprecedented times as the coronavirus spreads. A true test of our government leaders and our healthcare system now underway. First up this morning, Congressman Joe Courtney. What's being done in Washington to help stop the spread and bring people financial relief? The virus also shutting down Connecticut's capital during what was already a short session. State Senator Saud Anwar brings us up to date on what is and isn't getting done. Plus, he's on the front lines of the coronavirus. He's a pulmonary doctor. Dr. Anwar tells us what he knows about its spread and what you can do to protect yourself. Plus, a pizza shop trying to help those on the front lines. Fox 61's Tony Terzi reports. It's all today on The Real Story. Hi there, you're watching The Real Story. I'm Jen Bernstein. Well, the coronavirus has changed all of our daily lives. The U.S. government trying to come together in a time of political divisiveness and election year. We did see some bipartisan action, though, with a COVID-19 response package passed last week that included free coronavirus testing, paid leave, and expanded food assistance programs. I want to thank Congressman Joe Courtney for joining us remotely. You are at your Norwich Hall District office right now. Thanks again for doing this interview and being here.
Thanks, Jen.
All right, so let's talk about what's going on in Washington right now. Obviously, there's a lot of people who are looking to our leadership, the federal government as well as the state government, for guidance. How do you feel like Washington is working at this point?
So this past week on Wednesday, the Senate joined the House to pass a very robust coronavirus package. The vote in the House was 363 to 40. In the Senate, it was 90 to 8. And again, that's on the heels of another package that we passed a couple weeks before in terms of getting resources out to the public health sector. Again, very robust bipartisan majorities. So, I mean, that certainly is encouraging in terms of the narrative about Washington, that it's hopelessly polarized. There's more work that needs to be done in terms of helping the economy, really be protected from the brunt of the layoffs and obviously what's happening in the financial market. So there's more work to be done, but those are encouraging signs that the two sides really rose above the normal politics of Washington to get some real important help out there to people.
How is this going to help Connecticut? I know some of the things in it, free coronavirus testing, paid leave. Connecticut does have paid leave, but what should people who are working here in Connecticut know about the bill that was passed last week?
So number one, it boosted healthcare funding through the Medicaid program, and Connecticut's going to get $440 million new dollars in terms of infusing into our healthcare system to deal with coronavirus, whether it's testing and treatment, and that's all good. There's no question about it. It also, I think, knocked down some impediments for production of protective equipment, which is really probably the most critical issue right now in terms of making sure that our healthcare personnel are going to be protected when they do important work to deal with the rising numbers of possible infections here in the state of Connecticut. Food resources are also part of the package in terms of making sure that kids whose schools are shut down are going to continue to have access to lunch and breakfast. Senior citizens as well, who depend on nutrition programs through the USDA and through their senior centers and community action agencies. Again, infusion of money to make sure that we're going to get meals delivered at home. So that is going to happen in real life right here in Connecticut. But clearly, the onslaught of layoffs that are starting to come through that the Department of Labor has reported, we need a very strong economic strategy to get this economy propped up as quickly as we can. And there is money for the Department of Labor's processing of unemployment claims. And that, combined with sick leave and the family leave that you mentioned, I think will do a lot in terms of trying to protect people economically from the ravages of this economy that we're really starting to feel the first effects of.
And I know that you were just talking about protective equipment. That's an issue here in Connecticut. It sounds like from people that I've spoken with that healthcare workers have what they need for this moment, but they're really worried about the supply chain.
And they should be. I mean, the stockpiles, locally are, really getting drawn on very quickly. And Governor Lamont did put a request in March 11th to the national stockpile. We're going to get some delivery of, masks, gowns, et cetera, relatively soon. But frankly, as you point out, the supply chain is going to take time to get that flowing the levels that it's required. The Department of Defense is announced last night that they are going to transfer 5 million pieces of PPE equipment to the Department of Health and Human Services, which will help respond to requests from governors like the one that Governor Lamont put in also in the short term. And the bill that, again, passed on Wednesday included provisions to, again, knock down impediments so that we can boost production for companies like 3M Manufacturing that makes the filters, or things like the N95 masks that are out there. The demand signal now is out very strong. The resources are there in terms of the emergency funding. And in the meantime, we've just got to make sure that we're doing our best to be smart about not wasting equipment and wasting test kits, but really concentrating it on the most vulnerable populations and the ones where the risk is the highest.
Yeah, it's interesting in your district, if we're talking about testing right now, if you look at the number of cases in Connecticut, the second congressional district, if you look at it that way, really doesn't have that many cases, but a lot of people are saying it's because of a lack of testing. What are you hearing from people in your district?
Yeah, I agree with that opinion that, we should not take any real solace that so far the test results have not been as frequent as other parts of the state. Again, there are hospitals in Eastern Connecticut like Bacchus, Lawrence Memorial, and up at Manchester Memorial Hospital, which serves sort of the Vernon region as well, that are now standing up the drive-through, and I believe up in the Quiet Corner, Dade Kimball as well. It's just, you look, Rhode Island's got cases, Massachusetts has cases, New York has cases. No real particular region is inherently protected from the spread of coronavirus. And obviously that's why, it's all hands on deck right now in terms of making sure that national stockpile is replenished as fast and large as I think, we clearly as a country are going to need.
So many Americans and people right here in Connecticut are really worried because people who live paycheck to paycheck, or even small business owners, are all of a sudden in a position where their businesses had to close down, restaurants and bars, for example. What is Washington doing right now? Because they're hearing that the president's saying that he's trying to come up with a financial stimulus package. There's been ideas floated around about sending Americans checks. How close are we to something like that for the financial relief that people need?
So the package on Wednesday, again, was the first time in history that we've actually created a federal emergency sick leave benefit for people, again, who should not be coming to work because they're ill. And again, that law doesn't exist. Connecticut did get out in front of this a little bit, but there's no question that, that was a very smart and I think helpful move, as well as a family leave protection that was also included in that package for particularly employees whose kids are home from school because of the coronavirus closings. Unemployment, again, was beefed up as well. But in terms of getting businesses functioning, SBA has opened up, again, emergency lines of credit, which our office is helping companies in Eastern Connecticut access. These are low interest loans to hopefully get them over a tough patch. And there is going to be the large package, which, again, the negotiations started on that in the Senate. Simultaneous with the vote in the Senate on Wednesday, and ideas in terms of a direct cash payment, which has support on both sides of the aisle. Again, I think it should be, not used in terms of, high-income Americans, but really concentrated on people who are going to need it the most. In terms of, again, the brunt of the layoffs and closures and furloughs and delays and pauses in businesses that are happening out there. And again, I think, we can do that. We can be smart about this to make sure that we're giving enough stimulus to the places where it's needed the most, and also will have the biggest impact in terms of an economic multiplier effect.
All right, Congressman Joe Courtney joining us from his Norwich office. We really appreciate you Skyping in and keeping us updated. Thank you.
Great. Thanks, Jen.
All right, we have more to come on The Real Story. State Senator Saud Anwar, he's a pulmonary doctor in addition to being a state senator. What he's seeing in his advice for you this morning. We'll be right back.